Welcome to Doc Talk with your host, Brent Lovett.
Hello, welcome to Doc Talk with Brent. My name is Brent Levitt. This is our first episode here. I am the owner of Battleborn Financial here in Pahrump, and I want to create this series to help talk about primary care doctors and accessing care here in this town. A lot of people that come here and they always ask me questions about, when they were dealing with their health insurance needs in my office, they're always asking about who do I see for a primary care doctor, who's the best in town. And I want to create this segment and really interview and get to know the doctors. My office, we're not only a certified financial planner, but I have a couple health insurance agents that work with me that help people in finding the right needs for them, whether it be through the Nevada Health Link Exchange or even through Medicare. Our segment today is actually brought to us by Humana, who actually has been a great supporter of this community. They're really involved with us. They're our Medicare carrier. And in fact, I have one of their affiliate doctors here, Dr. Marianne Hazlett, that we're talking to today. And those that are on Medicare Parts A and B can actually join Humana. The nice thing about Humana, their HMO, it's a zero premium plan. And it's a zero copay to see Dr. Hazlett even. Right now, she just joined their PPO as well. Humana also offers a PPO. And one little common thing during this COVID crisis, Humana is actually waiving all their co-pays and stuff like that, even on their PPOs during the crisis. So it's kind of unique in what they're doing. But Dr. Hazlett, tell us a little about you and your practice here in town, and love to hear more about you.
All right, well, we have remained open for the COVID-19. We've been open the entire time. We do also offer phone visits, so patients that want to call in and get taken care of and get the prescriptions refilled and anything that they need, and they can still be in the safety of their home, but at the same time, if they want to come in, talk, if we need to examine them, we are welcoming them. Anybody who's sick, of course, we want them to stay home so there's no spread of the virus, but at the same time, we love to see people and we want them to come in. So our doors are open and we're seeing people every day.
That's awesome. And new patients to see you, I mean, you're one of the fastest in town. Like for people that say, oh, I hate to have to call my doctor, it's like 4 to 6 weeks, but you're less than a week, right?
Yeah, for a new patient, I can definitely see a new patient within a week. We also have walk-in daily. We also have patients that we can see quickly if you're sick, if you need something. We do have cancellations, and we just fill them with the patients that need to be seen that day. So we can get in people pretty quick. I also have a nurse practitioner, Paula Wabsis, who just joined, and she can also take care of a lot of these instant need kind of appointments, and she's open almost every day to have patients come in and see her as well.
A lot of people might even know Paula. They've seen her probably before at some other practices too, right? And you're now at your practice where you are?
She's new to me, but she's been in town a short time. She just became a nurse practitioner, and she's doing great, and everyone loves her. She's very sweet.
And Dr. Hazlett, her office is actually right there off of Homestead and the 160 in that little area right there. So she's pretty easy to get to. Her practice is growing. She's able to take new patients regularly. What makes you different what's your specialty, and what makes you better or different per se than any other doctor in the area you think that might be?
Oh, well, I'm a board certified internal medicine doctor. I also do skincare. The difference is we are a private practice, so I'm not an employee of a large corporation. So we actually have time to sit down, get to know our patients, spend time with them, and really be able to help. I also very interested in natural medicine, alternative medicine. So anyone who doesn't just want to take regular prescriptions, we can talk about diet changes, about supplements and different things they can do to improve their health so that they don't feel like they have to come in and take all of this medications. So I'm very much into alternative medicine, and that's
awesome.
Another option that they have.
And a lot of our Humana members, they really love the fact that it's a zero copay to see you. And even though a lot of their generic medications, a lot of them are zero copays and stuff on the plans, a lot of times they feel like they're just taking way too many. And even on a lot of those, some medications are really expensive. They have those tier 3 and 4 medications, which are some of those insulins or things like that. And you help them with other alternatives too and stuff like that, right?
Absolutely. And the other really good thing about the Humana plan itself is if you have heart disease or diabetes, they have a special cardiology and diabetic plan where a lot of these medications that can cost hundreds of dollars per month are covered at a very good cost for diabetics, especially when you're talking about insulin or some of these blood thinners for cardiology. It's very important to get those medications at a price that you can afford.
That's cool. And I was going to say one thing, if you're ever interested in, as we talked about these things, if you guys ever want to make an appointment with me or my office staff about getting plans, you can call my office. We're here local, the 419-6025. And I'd love to have you guys make an appointment with Dr. Hazlett's office, even for like a first-time visit. As you sign up for a new plan, getting to know Dr. Hazlett. I know for a fact every year I always make sure I get my annual physical, get my flu shot and everything like that. And that's one thing I do is I call my primary care doctor, who just happens to be Dr. Hazlett right now, and say, hey, we need to see you for a primary visit. And they'll get you in and get your lab work done at no cost. They do a screening just to get to know your doctor. It's important to establish care. Why was it important to establish care with somebody, you think?
Especially the first visit, because you want to get as much information, know as much about the patient, their histories. Everybody is unique and they all have a different background. And having that information and really spending time with that patient, especially that first visit, to know what's going on, it makes a big difference. Because if you can only spend 5 minutes, which if I was employed, that's kind of a way a lot of these big corporations are. You get this many minutes to spend with this patient, this many minutes to make your note, and all of these different restrictions. You don't have time to really know them or get to know what's going on. I mean, the relationship with your doctor is very important.
Yeah. What do you, for patients that are coming from other locations, like say they moved from California, they're a refugee from California or something, how do they, they're worried about their medical history and stuff like that. How do you guys handle that kind of stuff when they come over?
Usually, well, we try to get as many copies of records that we can. Also, what
How
we
do
do
they do
is,
that? Like, is that like something you order them for the client? Do they have to order themselves? How do they get those medical records over?
it's a combination, because some doctors are great about sending over records, others can take quite some time. What we do, if you have anything done by us, any kind of testing lab, we always give you a copy of all your results so you have your own file at home, which I think is really important, because even if you're relying, oh yeah, I signed something, you can get it from my doctor. If you have something with you, it is very easy to, to bring. So everybody should have a packet of their last labs, and as much as they, have any imaging, anything that's really important, they should have a copy of on them. And I really strongly believe in that, and I give everybody their copies. So, but we will get them. We will get them from the hospitals. I mean, we try to get as many records as we can so that we know everything, because they can tell you the story, but we also want to see numbers, which is important, because when we're trying to look at labs, we want to know what it was before, because if everything's always been perfect, it's great, but that's not the case, and you kind of want to know what the pattern is so that we can better treat.
Yeah, so your life is always a little bit different as you go on everything like that.
Absolutely.
I want to talk a little bit, just for a few minutes. There was a big scandal with you, and I want to just clear the air a little bit about that on the paper about you. And I think it's good. This is a good forum for us to talk about that a little bit, and I want you to kind of explain that a little bit and what happened.
Well, some people may have read the article in the paper. In March, I was on a cruise. I came back in the night I actually returned. I had a very high fever, and I got instantly ill. This was in the middle of when coronavirus, they hadn't really even started the quarantines or anything yet. This was very new to, with all of the restrictions, nothing had really started yet. I wanted to get tested, and I was basically told by the local hospital that if I needed to be life flown, or if I was, sick enough to be intubated, which that's kind of life or death type of thing where you're, respiratory failure, they could test me, but they didn't have enough testing at that time to do any testing. Now, I had very high fever. I was very sick. Luckily, I was able to get tested the next day, but I could, through a local lab, and I was negative. But I did have an article in the paper, because it was very frustrating when I called around Vegas. I called everywhere and I couldn't get tested, and I thought that was so important, because when you take care of all these people, and a lot of senior citizens who they said was a primary target, they have more health problems. You wouldn't want to get better and go into the office and be, and give anything or anything like this. So I quarantined myself until I had my negative result, which I was negative. And then they started the antibody testing about 3 weeks ago. My whole office, we all had our antibodies tested. None of us were positive. So we've never been, we're not immune, but we've also, never been around the virus. We've never contracted it or carried it.
So your office has been tested, been cleaned.
Oh, of course, yes.
You take utmost care of your clients and patients, stuff like that.
Oh, definitely.
The biggest thing I like is just the fact that, working with you, with Humana, all those companies, it's great just to know that you're easy to work with. I think the biggest thing people love about you is the fact that the skincare lines are phenomenal. I know my wife even saw you for some question about some moles and stuff like that.
Right.
And also knowing the fact that you're able to look at more than just here's a pill, pop the pill and be good. It's something they love, the fact that we have the wellness center here and stuff, and really open people's eyes to there's alternatives out there. And a lot of people in Pahrump love that, and the fact that you're able to offer more than just the traditional, hey, take this, you'll be better. It's other things involved with that. Another thing, we need more board certified people out there too. And there's, I don't know people. What does it mean to be board certified really? I mean,
well, it means like for internal medicine, you basically have to sit for a second set of boards. You have to train and you have to meet an expectation in testing, and it's yearly amounts of extra work that you need to do to keep your certification, meaning that you're kind of on top of your game and that you know internal medicine and what you're doing. So,
yeah, so you're actually certified and you're legitimate, you know. That's the biggest thing. Like, well, it's legitimate, but you have another board that keeps you standard.
Oh,
you know, on the financial side of things, I have a financial planning board that keeps me in line too. That says, you know, every year I have to do continuing education classes and say,
yes.
Pay them lots of money, you know, and tell them, hey, this is what we're, you know, I'm actually doing my job, and if I'm not held to my standard, I can lose that certification too, and those are always good things. What are the biggest things right now outside of coronavirus? What are some of the biggest concerns people are having medically right now, and that you've been seeing a lot of?
There's always diabetes, and there's always chest pain. So there's people are always afraid: is it their heart? Is it something else? And that's it's a very important thing to know what kind of symptoms really can mean your heart. What kind of symptoms are more like chest pain, like you've done an injury or you have costochondritis. And I always tell my patients when they tell me that they have chest pain, think about it this way: were you active when you had the chest pain? Did you start to sweat? Are you short of breath? Did you rest and now it went away? If you tell me, you know, you're just watching TV and you have chest pain, it's probably not your heart. But if you told me you got up, you brought groceries in, you got short of breath, you started having chest pain, you sat down, you felt better, now I'm worried about you. So you want to know, and you want to know when to get tested and what to do. And we do have a cardiologist here in town that does cardiac PET, which is a fabulous alternative to the old-fashioned stress test, because it really tells you your risk of having blockages in your heart. It also tells you sudden cardiac death risk. I mean, so it's a very good test. So for someone, you know, if you're worried about your heart, that's a very important thing.
That's awesome.
And we can set you up to see him as well.
I think I want to talk more about that. We're going to go to a break in a minute, and I want to talk more about that, talking about heart health and things like that. And we'll talk about it after this break. And I think we have a few more seconds. But I mean, I think it's Dr. Eric's office, right, is what you're talking about, referring to? He's actually part of the Humana network, too, and a part of the referral network. Not only is he here in town constantly, he's actually a part of our community as well. And
he lives, he lives in my same community.
Yeah.
So.
I think the biggest thing people love in Pahrump is those that we all live here and we're a part of the community. You see us in the store, meet you everywhere we're at, and it's great to know that we have a physician that's here, that stays here in the community. She's built the business up here, and we'll come back to that.
We will return with more Doc Talk after these messages.